Aminul, welcome. Yeah, I can see.
Welcome, thank you. আমি একটু এসআর ওসমানী সাহেবকে একটু সালাম জানাতে চাই। আমি ওনার ছাত্র ছিলাম ওই ইউনিভার্সিটি বালস্টারে।
আপনি আজকে এসেছিলেন? I'm sorry, ভুল হয়ে গেছে, ভুলে গেছিলাম।
জি জি, ভালো আছেন স্যার?
Thank you for reminding.
I see David Hume. Is that David Hume? Welcome.
Okay, thanks. Great to be back in Bangladesh.
Are you?
Hi, great to see you.
Are you in New Zealand or in UK?
I'm back in the UK. I've been repatriated.
Okay. All right.
Oh, very good for you.
But I find it's a banana republic. No. It's a banana republic here compared to New Zealand. New Zealand, they have proper government.
When did you come back?
Let's reserve the ammunition for the discussion itself.
Shamsul Alam Sahib, Assalamu alaikum.
Yes, কেমন আছেন? ভালো আছেন আপনি?
আলহামদুলিল্লাহ ভালো আছি।
এবং সবাই ভালো আছেন আশা করি।
ভালো আছি।
আপনার রিপোর্ট পড়ছি, ভালো হয়েছে। এটা হলো আমার প্রাথমিক আপনাকে ধন্যবাদ এবং কি বলবো অভিনন্দন, ভালো করেছে।
ভালো হওয়ার চাইতে মোর ইম্পর্টেন্ট আপনার কাছে ইউজফুল কিনা?
না, ইউজফুল, of course, it will help us design our own recovery plan in the 8-5-year plan.
Thank you.
তো আপনার সঙ্গে যোগাযোগ করব শর্টলি, বাট we are happy to be বলি।
আচ্ছা, থ্যাংক ইউ।
Welcome, Hamid. All right. It's 2:04. I think let's give it just one more minute, and then we start with a 5-minute.
David Hume, how are you?
Yes.
Hearing me? No.
Yes, very much so. Very much so.
Mom, you have more books than me. Siddiq, you don't have any books.
It is Ronak's section of the library.
Perfect.
You can see I have none.
No. Spend your time.
Okay. I think it's countdown now. It's 2:05. I suggest we get started. All right, Umama, kick off.
All right. Thank you, everybody. Good afternoon and welcome to today's webinar, where we will be formally launching the report for the PPRC-BIGD Rapid Response Study on livelihoods, coping, and support during COVID-19. Today's session will be chaired by Dr. Hossain Zillur Rahman, Executive Chairman, Power and Participation Research Center, PPRC. The findings from our study will be presented and discussed by Dr. Hossain Zillur Rahman and Dr. Imran Matin, Executive Chairman, Brac Institute of Governance and Development, BIGD. We are also very grateful to be joined by a stellar cast of discussants. Today we have with us Professor Rehman Sobhan, Chairman, Center for Policy Dialogue, CPD, Asif Saleh, Executive Director, Brac Bangladesh, Professor Shamsul Alam, Member and Senior Secretary, GED Planning Commission, Professor S.R. Osmani, Professor of Development Economics at Ulster University, and Professor Naila Kabir, Professor of Gender and Development at the Gender Institute, London School of Economics and Political Science. Before we start, I would just like to go over a few protocols for today's webinar.
Umama, can I just, someone has started sharing the screen. I think if you can just wait a little before that. I think Imran probably. Sure. Okay, continue.
Sure. And so a few protocols for today's webinar. If everybody who is not speaking, so during the presentation and while the discussants are talking, everybody please put your microphones on mute. And we will have a short session at the end where people will get a chance to interact. So whoever is speaking can unmute themselves and turn so that we can run this as smoothly as possible. Okay, I think that's all we had from our side. I will hand over to the chair, Dr. Hossain Zillur Rahman, to carry on. Thank you.
Thank you. Thank you, Umama Zillur and Nusrat Jahan. We now get started, and I welcome from my side and from also Dr. Imran Matin joins me as the Executive Director of BIGD. We shall be presenting the report. This is the fuller report. We had an earlier presentation on 16th April, was the preliminary findings. Now, today we'll be sharing the full report. And as was mentioned, we will have designated discussants and also an opportunity for open discussion. For the open discussion session, I would request everyone, you can both use the chat box. If you have comments, you can write your comments, start writing comments there. Also, if you want to speak, there's an option to raise your hand. It shows a raised hand icon. Use that. That's the protocol we'll use for the open discussion session. We expect to run this for about 1.5 hours, maybe a little more than that, and divide it into 3 segments. First 30 minutes we'll devote to presentation. The second 30 minutes we'll have the discussants, and the final 30 minutes we'll have for open discussion, and then there'll be a very brief roundup. For the discussants, I have to request that since the format here, of course, imposes the time limit here in a rather strict manner. So I'll request you to really limit yourself to 5 to 6 minutes. And if possible, if necessary, you can again come back during the open session. So just a little by way of the background, why this study was undertaken. As you know, both Power and Participation Research Center, PPRC, and Brac Institute for Governance and Development, both are national entities, very socially engaged. And in early April, myself and Imran, I had written an op-ed, Imran had responded to that. We discussed and we really launched this rapid, that's what we're calling a rapid response survey. But what we have realized, having done the survey, that rapid or not, it has followed all the rigor of research work itself. It's not a casual research. I want to really emphasize that. And as you will, the report is available and we will share it with everyone. The digital version is available, we will share it. The research has been absolutely rigorous, and both from PPRC and from BIGD, a very dedicated research team have really put in huge amount of effort, both to undertake the research itself and then of course to prepare this report. I also want to really thank the respondents. As you know, these are people who are under crisis, but they agreed to share a bit of their time to respond to our questions. And for Bangladesh too, and for the Bangladesh research community, this is actually a new breakthrough in a way, in the sense that telephonic surveys are possible and can yield good research results. I think we have done that before, but this time, really it's shown to be really good. So without further ado, the presentation will be divided into 2 parts. The core findings on livelihood scoping support will be presented by Imran Matin, and towards the end, I will do some summing up in terms of policy implications and analytical takeaways. And Nusrat Jahan will operate the screen, and we now start with the findings. Imran, it's your show now. Please start the sharing the findings. Imran.
আপনি কি করবেন অপারেট নাম করব
let me if I can find it.
Susanna Savage from Economist is asking whether it is possible to record. Yes.
Nusrat, could you share, because I think I'm having some difficulty.
And all those who are asking whether they will get the report, yes, you will get the report.
Okay, Nusrat, could you share, please?
And Nusrat, go to the, I have already spoken the first slide, so you can start from the slide 4. Oh, yeah. Okay. Yeah, start here.
Okay, Thank you very much. I think Zillur bhai provided you a background. I don't really have to, kind of go through this, but I think the main purpose was that we felt that whilst there was a lot of rapid, limited survey that was basically going on, we felt there was a need to provide a national level perspective in terms of the early and the immediate effects of the COVID crisis in terms of people's livelihoods. And the way people were coping and what type of support mechanisms were actually operating, so that was the basic purpose. So let's basically move to the next slide. So this is the team. I just want to, acknowledge that actually we had the BIGD team. The technical team was actually led by Dr. Narayan, along with Shakil Ahmed, Atir Rahman, Tahsina Nas Khan, Muntazina Tasneem, and Nusrat Jahan. And from PPRC, Zillur bhai was the overall lead, and we also had Muhammad Abdul Wazed, Umama, Sabrina Mitigain, Fatima Muhammad, and the field research team. And of course, with BIGD also we had a field research team. Okay, so a bit about the sample and the profile, the sort of initial profile. So this sample came from drawing a random subsample from a larger survey that BIGD had done. So one was an urban census from 2016-17 of over 24,000 slum households in 35 slums across 9 districts of the country. And we drew a sample of about 6,000 households from that. And from rural, we had a larger survey from a nationally representative at the divisional level survey of over 26,000, almost 27,000 households across 64 districts. The rural survey was essentially done as a part of a Brac survey to really understand the extent of coverage and depth of coverage of Brac's program. So the rural survey had a bit of a bias towards the kind of population group that Brac programs tend to target. So it was a relatively poor sample than one would have in a typical nationally kind of national poverty distribution. So that's an important point to note, and that's something you would see later in terms of the distribution. So the other point is, so we drew randomly 12,000 households from these 2 surveys, and we had a success rate of 5,471 households, just slightly below 50%. And I think this is a point that I will talk about a bit more later. The study period was from, as I said, very rapid, from 4th April to 12th April. The idea was very much to capture the immediate early effects. And if you remember, this was just after the government announced the general holiday lockdown period. And this was just trying to capture the immediate effect after that. In urban rural, 49% urban, 51% rural. Average household size was 4.8. We had 12% female-headed household, which is very close to the national average. Next slide, please. In terms of income categories, we divided the whole the sample into actually 4 income categories. We had the extreme poor, which is households whose per capita income was below national lower poverty line, moderate poor who are between lower and upper poverty line, and the rest is non-poor. But we divided the non-poor after really talking to some experts in terms of vulnerable non-poor and non-poor. And the vulnerable non-poor are those who are above the upper poverty line but below the median national income. And the non-poor are those who are above the median national income. So non-poor are basically sort of 50% of the distribution, and then we have the rest 50% of the distribution divided between extreme poor, moderate poor, and vulnerable non-poor. And as you will see, the vulnerable non-poor is a very important category because in the Bangladesh context, we've really had rapid reductions in headcount poverty, but I think it's been primarily from extreme and moderate poor moving to vulnerable non-poor category, and we will see that this particular group has actually kind of been the group where we've had a really, really large impact, and the vulnerability in terms of this vulnerable non-poor group is extremely clear. Okay. So this is in terms of the household's income, the economic profile. This is in February. We basically what their household's economic profile was, and it's basically, as I said, that there's a bias towards poor, where about 60% are extreme poor and moderate poor, and 40% are roughly vulnerable non-poor and non-poor category. Now, this is really interesting because two effects are happening here, right? I mean, the reason why we have slightly bias towards the poverty category starts from the fact that the rural sample itself was slightly biased because it was sampled for a particular purpose. That was the original rural survey, but there are other two biases that I want to really talk about here. And it's really important that we understand. So one is the February. This was the telephone survey. So one of the constraints of telephone surveys, of course, it's a very short survey, no more than 25 minutes. So we have to be really parsimonious in terms of questions. So the income that based on which we basically have this distribution here is based on just asking people what the income was, which is obviously a very reduced version in terms of how one actually does in a household income expenditure survey. So a bit of the bias comes from that because there's inaccuracy, but also people's reported income at that particular point in time in terms of what their income was pre-COVID would have a downward bias. It's very, very likely, and especially given that we were talking to poorer segment, it's likely that they would have a downward bias. So that's one reason we may have even more bias towards poverty sample than we would otherwise have in the original sample.
Imran, I just want to add one point for the general population audience here is that reported income is a frequently used proxy indicator for much more rigorously collected income. So we have essentially used a proxy indicator here, which is a fairly common practice in such rapid surveys. Go ahead.
Exactly. So, but I think that I just wanted to point out that would create a bias in this kind of a context when you're asking people about their income just before the COVID. It's likely to have a downward bias for which we may have a bias. And the other bias, which I think is very interesting, and we don't really have direct evidence on this, but it is possible that our successful cases were poorer than the cases who were not successful. So that would create an additional bias in the sample in terms of the poverty profile of the respondents. So this is basically the poverty profile of the successful respondents. So I think it's really important. This has got methods, points, methods, implications, and something that we may want to come back in the conversation and discussion later. Okay, let's move on. So this is with respect to main sources of income pre-COVID again. As you can see, I think this largely reflects again agriculture, livestock. In a typical rural setting, perhaps one would have expected a bit more, but this is again drawn from a sample which is focused on a rural survey of sort of Brac. So that may be slightly lower, but I think generally we have a good distribution here in terms of different income, different main sources of income of the household. We actually did analysis to look at whether there are differences with respect to occupational or income, main sources of income with respect to the results that we get. We actually did not find any discernible differences. So we have not reported any findings with respect to differentiated by main sources of income. And that could simply be because we were at a very early stage of the crisis. And as we go on through the repeat survey, we'll basically see whether the main sources of income actually starts becoming an important driver. Okay. Now let's move to some findings in terms of the impact on income and employment. So first, we asked a question on mobility because during that time, we had these images of large-scale mobility that was basically happening. At least that was the sense that one was basically getting from the news. We found that only 6% of our urban households moved into the rural homes during that time period. Now, the 6% of 6% of the total urban household moving within such a short period of time, within a 4 or 5 days, a week time period, I think is health-wise extremely sort of concerning. So that concern, I think, is still important from a health point of view. But it is also important to realize that large number of urban households actually stayed in the urban areas, did not move, right? And we slightly more non-poor urban households moved to their rural homes compared, but this was really not particularly hugely different. And we did not see any significant difference across occupations. So I think this is an important point. Okay, now in terms of economic inactivity among main income earners, we basically see, and this is a pattern we see, the urban face of the effect is extremely clear. I mean, of course, rural is also affected, but there is greater resilience we see in the rural areas, at least in the immediate short term. Now, to what extent it lasts is something we look at, but we basically, a theme that emerges across is the urban-rural divide, where I think urban poor and vulnerable non-poor in the urban areas fare particularly badly. And we see this here as well in terms of economic inactivity. Next slide, please. And obviously that leads to drastic reduction in household income. And you can see in the urban slum areas, it's particularly pronounced, in the rural areas too, but much more in the urban slum areas. Across the income divide, extreme poor, moderate poor, of course, high, but not, quite serious also for non-poor and vulnerable non-poor in particular. And the average, the average, the non-poor income, the drop is actually below the upper poverty line. So I think that's on average, the non-poor reduction has also been pretty significant, rendering the average drop to have dropped below the upper poverty line. Okay, let's move to the next one. So let's move to food insecurity. We looked at food insecurity through, in a sort of from a couple of dimensions. One is we looked at drop in per capita food expenditure. That's one variable. And here again, we see urban slum faring worse than rural and across the board, including non-poor and vulnerable non-poor, very similar pattern. But the differences here in terms of urban slum and rural, in terms of drop in per capita food expenditure is not that much. It is there, 28% versus 22%, but it is a 6 percentage point difference. This particular difference we see to be much higher for some of the other dimensions of food security. Let's move to the next one. And here we look at household having 3 meals a day. This is another way of looking at food security. And here we see a very large 10 percentage point difference between urban and rural, a much larger difference. And also far more pronounced difference across the income categories, much sharper for the extreme poor and moderate poor compared to vulnerable, non-poor and non-poor. So here we see a much sharper pattern in terms of the differences. Coping through reduction in food consumption, we asked respondents to in terms of how they were coping with the crisis. We'll come to the coping section later, but one of the ways people were coping, people reported to be coping, is through reduction in food consumption. Again, we see a very similar pattern here in terms of the urban story and the difference between urban and rural. Okay, now let's move to coping. In the coping, we asked respondents how the houses were coping, and we divided the coping mechanisms in terms of personal coping mechanism, social coping mechanism, and external support coping mechanisms. In terms of, we see that largely it's personal coping mechanism that was still the predominant way in which people were coping, at least during the initial phase, and then social, and then external was least important. What's also important that in terms of the coping mechanism, if we think about drawing from income or savings to be a more positive coping mechanism compared to borrowing or reducing food, we basically see again an urban-rural divide there as well. I think rural households tend to be more reliant on income and savings, whereas the urban households had to rely more on borrowing and reducing food. Selling asset was very low, but there's more in rural than urban slum. Of course, the type of assets that one would sell is sort of low. But of course, something we will be monitoring very closely in terms of what's really happening in terms of coping. In terms of social coping mechanism is primarily family, friend, and relative, remains to be quite strong. And interestingly, it's sort of important also in urban slum and sort of also in rural areas. Government support and NGO support was just beginning. And what's really interesting there is that there was an urban, at least in the initial, this is very early on, I think the focus in terms of government NGO support, and rightly so, given that the urban dimension that I until now have been talking about, that the government support and NGO support really focus much more in the urban setting. Okay, let's move on to the next one. So we asked respondents in terms of their self-assessed staying capacity, how long can they feed their families? And this was 8 to 14, that was the time we did our survey. So we looked, and then we see that it's basically, we have crossed the 8th of May was the, within a month, nobody reported they could last beyond that with their existing resources that the household basically had. And here again, one sees a difference between urban and rural. In the urban area, you basically see a far lower staying capacity compared to rural. In rural area, one sees a higher staying capacity compared to, in relative terms, compared to urban areas. And that comes with the rural, this is with respect to food security primarily. I think the resilience around that is higher among the rural segment than the urban segment. Okay, moving on. So we asked, we've also asked about what are the priority concerns. There's a multiple response. Very, very interesting. This is early days of the crisis again. And the early days, we see that actually the health and hunger divide that people talk about is just not there. People are deeply concerned about COVID-19 infection, as they are concerned about the maintaining family and decrease in income. And they're concerned also about the increase in food prices. And interestingly, they're not concerned about reduction in food supply in the market. They're concerned about increase in food prices that may happen, not necessarily only because of supply chain disruptions, which is maybe one of the factors, but due to other type of factors that in terms of trading blocks and in terms of different types of unfair competitive policies or competitive arrangements through which prices may actually go up. So this is really interesting in terms of the priorities that we find among and we don't see much of a difference really among the different. So this is not the case that for extreme poor, moderate poor, you have a very different priority order compared to vulnerable, non-poor. What's also interesting is mental stress. Now that also comes as a not such high order, but not unimportant either, and across the board. And this is something that I think is sort of worth paying attention to. Okay. Let's move. Gender impact. So yes, as I said, 12% of our sample was female-headed households. So we looked at female and male-headed household, and very interestingly, we see again an urban-rural divide. In the urban areas, we see that among female-headed household, there has been a far greater reduction in both food expenditure and number of meals compared to male-headed household. So in urban slum, female-headed households are worse off in terms of food insecurity, both in terms of food expenditure and number of meals reduced. In rural areas, it's only in case of number of meals, and that too is 19% versus 14%. It's not really that large compared to the differences we basically see in the urban area. So again, this is really important for female-headed household. We see a more severe effect of female-headed household in the urban context compared to the rural context in terms of food security. And interestingly, we also find that more female-led households reported getting support from government, neighbors, NGOs. So, this whole, in our social, informal and formal social support structures, the female-headed household as a vulnerable category is embedded in the way we think about vulnerability. So it's sort of really, interesting to see how that has also emerged, not only with respect to formal support, but also with respect to informal support mechanisms as well. Let's move on. Support. Now we move to support. We asked respondents what type of support, cash or food. And early days, this was result from early days, it may change now. We actually saw that this whole cash versus food did not play out in terms of how people were actually responding. Both food and cash were important in terms of the support, the mode of support in which people wanted support. And interestingly, you can see in urban areas, food support is really, really, more. They are relatively, the importance of food support compared to the rural is sort of higher, and also compared to cash support in the urban slum. And again, that could be related to the overall food insecurity and the food availability and the agriculture related sort of dimensions of urban and rural poverty. So we see that, and again, between extreme and moderate poor, we see pretty both cash and can being important, and I think that's sort of, I think, quite important in terms of designing of support. I think both cash and food were actually taken into account as something that we'll come back to in terms of the design of the support package towards the end. Okay. We basically wanted to, we asked respondents, how much support per month would they want? And we thought that people are just going to ask for things, ask amounts that are like, totally out of the world, totally out of whack from reality. And we found that actually that is not the case at all. We found in the between support requested and their decrease in income from February, there's a huge correspondence between those. Actually, as a matter of fact, they are more or less the same, right? And that gives us I think we should trust people. Even in the greatest distress, people generally are not after kind of handouts and don't want to live, take benefit out of handout. Want that to basically stave off hunger and keep afloat so that they can move on. But I think it also basically gives us a bit of confidence with respect to our telephone survey as well. So, and these are the figures we basically use. So just to draw your attention to the average support that in the rural case, poor and new poor. So new poor are those households who are in the vulnerable non-poor category who fell below the poverty line. So this is the new poor category of households. So the average amount that the poor and new poor in the rural area ask for is 1450 taka per month per capita support, and their income drop was about 1500. And in case of poor and new poor in the urban context, 1700 is very, very close. Both are extremely close. Okay.
Yeah.
I think I'll stop here and try to.
Thank you, Imran, for that excellent overview of the findings. As you saw, everyone, that it was a rapid survey, but it was extremely rich, empirically rich survey, because we really spent a lot of time in designing the whole thing effectively. Now you have heard the bulk of the presentation, and now I just want to close the discussion session by really picking out the key analytical takeaways first. Next slide, please, Nusrat. So first one that I want to mention is that in the way we have discussed in the recent times, the way we discuss poverty in the Bangladesh context, in the headcount ratio, the percentage below the poverty line, which is about 20.5% by 2019 estimation, extrapolation from the 2016 highest data. But the COVID-19 impact is really showing us that we also have to look at the population above the poverty line, that there are a large chunk above, technically above the poverty line, but who are very vulnerable to risks. And we found that, yes, they are not just theoretically vulnerable, but actually the COVID impact, we see that that group, and as was explained by Imran earlier, that we really, and I want to also thank colleagues from the Bangladesh Bureau of Statistics, current and former, who really also helped us in the conceptual framing of this vulnerable non-poor, who are those between the band between the upper poverty line and the median income. Now, not all of them, obviously, they are vulnerable. Poor, non-poor doesn't mean that all of them necessarily become vulnerable. But we wanted to assess what percentage of this vulnerable non-poor actually were affected. And I think the survey really has given us an excellent parameter here, that the vulnerable non-poor, that group, when we compare their pre-COVID income of February and the reported income in early April, we find that 73% of the vulnerable non-poor category in the rural areas actually fell below the poverty line. And in the urban context, it was even higher. It was 87%. So we have an opportunity here to understand that vulnerable non-poor, why it is so important to take them into account. And we have actually coined this term new poor. So we have to talk of the poor and the new poor. The new poor are those who were above the poverty line in the normal times, but under this COVID impact, they have now fallen into poverty. So this new poor, and as has been stressed by Imran also throughout the presentation, the impact has been much more severe in the urban context. 87% of that band actually fell into poverty, and therefore we have to, planners and government have to not just do the traditional social protection for the poor, but we also have to talk about this new poor and what to be done with them. So that's, I think, a very important analytical takeaway. And as you can see, that if we add this new poor category, what happens? We, in the Bangladesh context, officially we see 20.5% is below the poverty line. So that's the poverty rate. But if we factor in the new poor, we have to add another 22.9% to that poverty rate, which makes it nearly 43% are actually the poor and new poor in the current reality. And the percentage for the rural and urban, these, for the rural poor, that percentage we have to add 21.6% to get the new poor, and in urban context, 25.1% has to be added. They are the new poor category. So as a whole, we have the poor 20.5% and new poor were 22.9% of the overall population. And that makes it 43% for the poor and non-poor combined. That's a way of thinking about the poverty dynamics that I think this survey has really thrown out in a very strong manner. Next. We also actually, I think the survey has given us a very good basis for not just generally saying that the poor need support, but try and come up with some hard numbers in terms of the actual fiscal package which is required. I think as Imran mentioned, we got a figure about the amount that people were wanting, and as was very rightly stressed by Imran, when we are doing this telephone survey, we got actually realistic assessment. These are assessment by the people themselves about how much support they would require. And it's a modest support. So we, using that parameter of the unit per capita per month support needed, we were able to use the number of population, the poor and new poor in the Bangladesh, in the rural context is nearly 42.9 million, and in the urban context is 27 million. That makes it totally 70 million who are the poor and new poor together. So in terms of fiscal package for the poor and new poor, taking the country as a whole, we have actually come up with these figures, which is about 6,232 crores for the urban context and 4,716 crore for the rural context, a total of about 10,948, say, let's say 11,000 crore taka, 10,949 crore per month required as a social protection support for the poor and new poor. And that's like a fiscal calculation that was possible only because we were able to get that very important parameter of per capita per month requirement, which came out of our survey. Here, I also, it's not in the slide, but I also want to add here that what actual support has come forth from the government. I got the official figures. Actually, the government has provided support both cash and kind. And the vehicle for the social protection support is, one is called the GR, Generalized Relief. That's both cash and kind. So in kind, which is rice, the amount GR support was 746 crore taka. And the cash, which is both for baby food and cash, that's about 97.8 crore taka. So a total of 844 crore taka as generalized relief was released. There was also a release of what's called the fair price food support, which is the open market sale. It was, around 500 to 600 crore taka were allocated for that, but then that was stopped. And now government is yet to restart that. They are preparing some list, beneficiary list, etc. But an issue here, of course, is that in the open market sale type of social protection program, these are essentially self-targeting. But under the COVID-19, preparation of a list means that it's no longer self-targeting, it's also a targeted program. And there's a debate, I think, particularly Dr. Shamsul Alam can take note, that in such circumstances, whether the self-targeting programs, when the system-wide impact is rather large, whether that might be a better option. Besides this 844 crore taka, which and around 400 to 500 crore taka, which was allocated, if we add that to, that comes about, let's say, about 1,300 crore taka. Besides that, this whole discourse about new poor has had some impact on official thinking, I think, because a new program, Finance Ministry has just released 1,250 crore taka for cash support, mostly to urban, but here also the list preparation process is underway, but at least we can take into account that allocation has been made. So vis-a-vis the required allocation of 10,949 crore taka per month requirement, what we see is that the official assistance so far, if I add just the actual, if I exclude the OMS one, it is about 2,094. That's about a fifth or just under a fifth of the requirement. So that gives you a idea about the type, the gap in terms of the social protection needs, which needs to be addressed. All right, so this is about the key analytical takeaways, and I just want to conclude with just going through the key policy implications. First one is that this is a system-wide poverty impact. It's deep and system-wide. And as I mentioned, this targeting issue, where this, in particular in the urban context, the targeting has to be done, but in some self-targeting measures also, I think, are important here. And the impact has been more severe for the urban poor. That also, I think, has been mentioned. The income drop, as I need to reiterate, that the income drop is as high as 75% between February and April, taking the average as such. But of course, people cope. And initially, what we saw is that though income dropped, food expenditure also dropped, but not by the same amount, because people use up other resources to maintain their food level. So the drop in food expenditure was on average 28%, as distinct from the income drop of 75%. The urban poor has offered an opportunity. In the Bangladesh context, much of our social protection program is primarily focused on the rural poor. But I think after COVID-19, we have to begin to jumpstart the social protection for the urban poor. And that program needs to be, I think, really focus our attention in the coming days. And as was already mentioned, that the whole new poor category is a very important new concept, which means not just from a social protection angle. I think the whole idea is that when you think about how we are progressing on poverty, it is not enough just to look at the headcount measure. We have to look at that band of vulnerable non-poor and the range of, and their economic realities, the durability of the type of informal occupations, how vulnerable these occupations are. And those issues, I think in the coming days, the poverty researchers would really have to address that in a big manner. But I think Imran mentioned that also. Poor have been affected, and their concerns with the livelihood is of course understandable. But they have also expressed their concern on the health, on the COVID-19 infection. So I think from the part of our respondents, the issue is not life versus livelihood, but it's life and livelihoods. And I think it is not enough just to push the whole idea onto the people. And I think the policy in terms of ensuring the life part and the livelihoods part both need to be taken into account in a combined manner. So I think that's, very important. Food and cash, food or cash, that debate is not really relevant at the moment. Both are needed. And the reason urban poor have prioritized food needs in early April was that they were also witnessing some food price hike even at that time. So I think food and cash both will have to be kept in mind as we move ahead. And we have to also mention, as I mentioned, the size of the stimulus package. Various stimulus packages have been mentioned for various economically very prominent groups. But I think we have a clear idea that about 11,000 crore taka fiscal support per month for the poor and new poor for the foreseeable future, that's a level of social protection support that I think the policymakers have to be taken into account. And here the new poor actually are a very important category too, and we have to really focus on them also. But I mentioned that the focus, I mentioned the issue of self-targeting, but the really attempt at the moment is targeting, meaning various types of lists are being prepared to ensure that the food and cash support reaches the intended people. But here, I think already we see that the last mile delivery challenges has got to be a very important concern, because already the problem about the accuracy and the governance of the list preparation process has featured in the media. So the last mile delivery challenges will have to be a very important issue. And finally, I want to close on this point that why we did this survey. We felt that real-time data generation would be very useful for the policy response. And I think going ahead, this is, I think, even more important in the coming days. And PPRC and BIGD is in discussion for a resurvey, second round of survey in June. We hope to launch the survey. The questionnaire preparation is already underway. We hope to launch the survey in late May, early June, and share the findings with you sometimes in the third week of June. Because we also realize that we have research process also needs rebooting. We cannot wait for too much time between data collection and data presentation. For us, in the first round, it was exactly 5 days. But the full report, of course, is coming a bit later. But we also will undertake this new survey where we'll be perhaps looking at taking a closer look at the support dynamics, and development partners also have been very keen, shown keen interest, and I'm sure the government will also take keen interest here. In this second round, we will look, of course, at the livelihood dynamics, but the key issues that we'll be focusing on will, of course, also be looking at how the support dynamics are playing out, but we'll, I think, also be looking at the health issues a bit more prominently, because the easing the lockdown will be a key concern in the coming months. So how the health and livelihoods are simultaneously addressed by intelligent and ground reality-based easing policies would be, I think, very important. So I just want to mention that PPRC and BIGD, this partnership will be going ahead in terms of a new round, and down the line, we are in discussion of additional rounds also. With that, I would like to finish, and I would now like to initiate the designated discussion section. And can I start with Professor Rehman? Sobhan, would you like to come in later on? You can come in now if you are still on. You have to unmute.
I'd have to unmute.
I now hear you. Yes, please go ahead.
Can you hear me?
Yes, I can hear you. 5 to 6 minutes. That's the request.
Okay, very good. Well, again, my compliments to both PPRC and BIGD for work well done. I won't go into the small print of the methodology. I think one immediate issue which came to mind is that the numbers you were putting on the table before us applied to a period towards the beginning of April. We are now approaching the end of May. And I can't imagine that people who were surveyed are significantly improving their livelihoods and income earning capacities in this particular period. So in fact, if you had now raised your poverty levels to the level that they have now gone, including the new poor, how might the situation be looking today? Because it would then be getting to exceedingly alarming proportions. And the sort of numbers that you were actually projecting about needs would be then significantly higher. Because a great deal now really depend on the trajectories, both of the COVID and the way in which this is then impacting on sustaining livelihoods. In fact, if the trajectory continues upwards and it continues to constrain possibilities of earning livelihoods, including the possibilities that where livelihoods have been resumed, they have once again begun to sort of contract again because of the expansion.
Right. You got stuck, sir. Professor Sobhan. All right. Can I think Professor Rehman Sobhan's some technical difficulty there. Can I move on to the next?
Can you, Zillur, can you please ask Professor Rehman Sobhan to stop the video? That might help.
Professor Rehman Sobhan, if you are listening.
Okay, let me do it. I can do it from here.
Okay, but I don't know whether that will help, but do that. Sir, no, I think that's not helping. All right, I'll try and bring him back actually. Can I move on to then Dr. Shamsul Alam? Same request to you, 5 to 6 minutes, and for a second round later on. Dr. Shamsul Alam? Nusrat, is he on mute? Hello, Dr. Shamsul Alam?
I'm trying to unmute him.
Okay. while we go that, Professor Usmani was, are you on, Professor Usmani?
I am on and I am unmuted.
Okay, Professor Usmani, you go ahead. Dr. Shamsul Alam, I'll bring you in later.
Okay, thank you everyone. And again, I want to start by complimenting BIGD and PPRC for doing an excellent study during a very short period of time and maintaining most of the rigors that a study like this demands. So wonderful job done. And it has given an idea about the magnitude of the problem that we face today regarding livelihood crisis emerging from the health crisis. A health crisis is there, and we have to, in order to overcome the health crisis, we need to maintain physical distancing and all kinds of restrictions. And these restrictions will necessarily have an effect on economy. They will stop the economy from working. It has. And if economy stops, then livelihoods are lost. So it's a necessary consequence. The loss of livelihoods is a necessary consequence of fighting the health crisis. But that consequence has to be mitigated, and mitigated by a huge effort to help people maintain they have lost their livelihoods, they have lost their entitlements, but those entitlements to food and other basic necessities must be restored somehow. And your study has given some idea about the magnitude, and we can take it forward. In fact, I have taken it forward a little bit in my own report for the Planning Commission. Without going into the details, what you have to see, first of all, is basically almost half the population is in need of entitlement support. And it comes out from your study as well. And they have to be supported for quite a length of time. Over time, after a while, the level of support might taper down, but that tapering will happen only when the economy is ready to go back to reopening. And that will be possible in turn only when we have a sufficiently strong public health system which is capable of testing the people so that we can determine who can go back and who may not go back, and those who cannot go back, how to deal with them. So we need an initial phase, what I call the first phase of our crisis, where the main task is to build up that public health support facilities. Once that support is in place, we can gradually begin to reopen the economy. People will begin to gain their livelihoods. And at that point, the livelihood support can be begun to taper down. So roughly, you can think of a first phase where maybe it takes 3 months at least to build up the public health system, and then another 6 months or 9 months before the economy goes back to some kind of normalcy, because hopefully some vaccination is found which can deal with the problem. So you have to divide the entitlement support into two parts. The first phase, where almost entire half of the population, which is about 20 million households, have to be supported. And then over 6 periods of time, the support can decline. And if we make a rough estimate of how much support that would require, if we provide each of these households, start from lower poverty line, you don't have to even bring up to the upper poverty line, start with the lower poverty line and make an estimate of how much income they have lost. According to your study, they have lost almost 80% of their income. So restore the 80% of lower poverty line income, give it every one of these 20 million households, for all 20 million households for 3 months until the economy reopens. And as the economy reopens, some people go back to work, so reduce the support. If you do that, my calculation shows that over a period of the next year, the government will have to provide almost 4% of GDP for this kind of entitlement support. And when you have 4% of GDP, don't feel sense of consternation. Now, the package the government has already announced does come to roughly 4% of GDP. But that is actually seriously misleading, because a huge part of that support is actually loans, which will be repaid. Most of the fiscal cost for the government is interest subsidy. Loans will be provided at a subsidized rate, and the subsidy is the real fiscal cost. Plus, there are some grants and direct expenditure. And my calculation shows that if you add them, they do not add up to more than 0.5% of GDP. The actual fiscal cost of the package that the government has announced so far doesn't amount to more than 0.5% of GDP. So if we now have those packages, in my view, should be expanded too. Instead of 0.5% of GDP, it should be 1% of GDP in my calculation. So altogether, nearly 4% of entitlement support and 1% of other support. Plus we need 1% of health support too. Health, altogether nearly 6% of GDP, of which 4% should be entitlement support. And this, I want to emphasize that this huge amount of entitlement support that will be needed is not just for the sake of ameliorating the misery and the hunger and the starvation of the people. It is essential for successful reopening of the economy as well. Because if people do not get the support, if they feel hungry, they will go out of isolation. They will not stay home. They have to feed their family. And if they start going back to work prematurely, then the health crisis will be aggravated. And then you have to reimpose the restrictions. Then the cycles will continue. So if you want to manage the health crisis properly and want to reopen the economy safely, then we must have complete support for half of the population for nearly 3 to 4 months, and then gradually declining support. Government should commit their support for the sake of both humanitarian reasons, for removing the hunger and misery of the people, but also successful reopening the economy. If you want to revive the economy, want to get GDP on the growth path, there is no alternative but to give the initial entitlement support to everyone. That's the first point. The second point is, if we want to provide support on such a huge scale, half the population for 3 to 4 months, we have to have a very simplified delivery system. I think for that level of, that scale of operation, food support is very complicated administratively, logistically. I would propose a very simplified cash support system for everyone. The cash support should be provided digitally as much as possible, and it's possible these days through the development that we have in our digital finance system. The listing of beneficiaries is very important, and this should be done in a very transparent, cooperative manner at the local level, involving not just the government officials, but all segments of the society, the elite, the local people, and then the politicians, of course, but the NGOs and others should be involved in preparing the list. Once the list is prepared, it should be openly displayed. And that is important for transparency and for self-selection. If the list is openly displayed, then those who do not deserve to be there will feel shy to be shown in the list. There will be an element of self-selection. So what I'm saying is, it has to be a huge amount of entitlement support, not just for the sake of alleviating misery, but also for the sake of successful and safe reopening of the economy after a period of time. And this support should be provided in a simplified, unified framework with one single cash support program, delivered mostly through digital system, and the list being prepared and displayed in a very transparent manner so that everybody can see who is being supported and who is not. And once we can do that successfully, after a period of time, it will be possible to reopen the economy successfully, and then people will go back to work. You'll be able to reduce the entitlement support and then increase the enterprise support. Those enterprises will be reopening, then be given greater support. So it has to be a phasing. Big support for entitlement initially, less support for enterprises because enterprises are mostly closed. But once the economy reopens, then it can be switched. Less support for entitlement, more support for enterprises. This is the sequence we have to follow, but a big, big investment initially on entitlement support.
Thank you. Manibhai, wonderful. Thank you. Can I, Dr. Shamsul Alam, can you join now?
Yeah, I hear you.
Okay.
I don't know.
Okay.
You hear me?
Yes, we can hear you now. Please, Dr. Shamsul Alam now.
I greet and applaud PPRC-BIGD for conducting a rapid response research on understanding livelihoods and poverty dynamics during COVID-19 fallout. They completed this, you completed this research in April using a comprehensive database while the impacts of COVID-19 were unfolding during early 4 to 6 weeks of a phenomenon which is yet getting momentum. In this research, you have not reviewed the government supports and national rescue programs declared in early April. Rather, you have shown the impacts of lockdown following job losses and halting of business activities, culminating, intensifying poverty. I must say, job has been well done, and I'm quite happy with your research findings and leading to good policy implications. The poverty rate as of BBS in 2019, including extreme poverty, has been 20.5%. The researchers identified vulnerable non-poor are those above the upper poverty line and below the median income, constituting an additional 29.5, meaning median 50 minus 20.5, so 29.5. Survey findings have revealed that due to the income shock caused by COVID-19, 77.2% of these vulnerable non-poor, that is 29.5% of population, actually fell below the poverty line, who are 22.8, though apparently seem high, and you call them new poor. That means as the researchers within 6 weeks of COVID-19 fallout, the existing poor and the plus new poor comprise 43% people now who need to be addressed in the new emerging situation. That is, poverty level is 43% effectively. It is true, within the work stoppage due to COVID infestation, there has been fall back into poverty of the people who are within vicinity of the upper poverty line. Of course, different research groups may come up with different figures. The monthly cost estimates for the poor and new poor to support their livelihoods has been estimated by you researchers costing around Bangladesh taka 4,746 crore for the poor and taka 5,338 crore for the new poor. This makes a combined fiscal average of Bangladeshi taka 10,058 crore. In 3 months package, it would require 30,174 crore taka, quite a big sum, of course. GD Planning Commission requested BIGD Brac to support a study to help come up with a short period recovery plan to be incorporated in our 8th five-year plan, along with other approach papers. You heard Dr. Usmani, Dr. S.R. Usmani authored the paper. He estimated at taka 8,000 per household per month. So use is higher anyway. In the second phase, when the economy begins to reopen, the number of households needing support will gradually decline, but the level of support per household will remain the same. So that is the question. When the economy is recovering, some will be employed. Still, the amount to be supported will remain the same. In the 2 phases, very short with lockdown period and the period when the economy begins to reopen, the entitlement support program will require taka 960,000 million, which is about 3.8% of GDP, just covering entitlement support programs. Both these studies will help us arrive at implementable recovery plan within the broad framework, broad macroeconomic framework. PPRC-BIGD study will help us designing short-term recovery plan in the 8-5-year plan. Now, I would like to refer to a few of the government emergency relief supporting health services and enterprise support programs nationally designed. Allocations of disasters and management and relief. 1 lakh metric ton of rice costing 434 crore taka already allocated. General cash relief to purchase food taka 80 crore. Open market sale of rice at taka 10 per kg costing around 195.25 crore taka. Emergency health services support taka 250 crore. Allowances for widow and husband divorced women and old age allowances in 100 poorest upajala in Bangladesh, all will be covered in those upajalas. And other than this, taka 250 crore to 50,000 informal sector job losers. Each one will be provided with taka 2,500 at one time before Eid. Food and cash grants are provided to 1 crore households so far. To mitigate the average impact of global pandemic, the government of Bangladesh has taken a work plan with 4 major strategic programs to be implemented in immediate, short-term, and long-term plan of 3 years. Now I have to refer some of the words support, employment support programs. Salary support to government workers, 5,000 crore provided as interest-free loan. Working capital for cottage, micro, small, medium enterprises, taka 20,000 crore at 4% interest rate by businesses and 5% interest subsidy to be provided by government. Working capital for affected industries and services, taka 30,000 crore at 4.5% interest rate by the farms and 4.5% interest subsidy by the government. Export Development Fund has increased with reduced interest rate, increased from 3,500 crore to 5,000 crore. Another support program is pre-shipment credit refinance scheme of Bangladesh Bank with fund size of 5,000 crore taka at 7% interest rate. Here I am referring these livelihood support and economic recovery programs to indicate that in the very early stage of infestation of COVID-19, government has adopted a well talked out national programs. Livelihood support programs are supervised at district levels, supervised by the top bureaucrats to avoid leakages and avoiding inclusion and exclusion errors. 250 elected representatives at the local government have already been sacked, suspended with malpractices in distribution of relief goods. To make economic recovery moving on, we have to resuscitate market activities as soon as possible. How we can do that? How to switch over to economic activity as soon as possible, containing COVID-19 infestation. We need suggestions from think tanks. Already as Dr. Usmani gave us some hints how to go with, and we want more suggestions from economists, how to move to next stage of invigorating our economic activities and how to take help of how to initiate market activities as soon as possible. Thank you.
Thank you. Thank you, Dr. Alam. I think Professor Rahman Sobhan was cut off early and he has rejoined. I would now invite Professor Rahman Sobhan to finish his input. Professor Rahman Sobhan. Thank you, Dr. Alam again.
Okay, I think I will simply try to reconnect with what Usmani put on the table. I think the critical issue, of course, is going to be the mode in which the interventions are going to take place. Usmani's suggestion of cash-based intervention has, of course, considerable administrative and logistical advantages. However, the big practical problem is going to be that if the onus of recovery in terms of at least consumption is going to be put on cash transfers, then this is going to require a huge reactivation of both markets and sort of supply side responses. And of course, for that to take place during a period where the COVID curve is still in its unknown and upward trajectory is in fact going to be a highly dangerous development, because we actually remain largely uninformed about the extent of the infestation. Statistical information is weak. Medical interventions are grossly inadequate over there. So in the event that very large numbers of people with cash in hand are in fact going to come running to the market and supply side responses are taking place, this is going to have a secondary impact on the infection process, which will have to be taken into account. So how that is going to be dealt with remains uncertain. The other problem, of course, again, is the governance fallout. I think one of the huge problems that have arisen over here in terms of managing the COVID has, of course, been the inability to really impose any sort of discipline on the way in which social distancing is actually practiced, and some attempt to, in fact, actually enforce ground rules set by the government. I think we are all witness to what is going on in Eid, where hundreds of thousands of people are moving from a high infection area, which is Dhaka, into low infection areas across the districts of Bangladesh. And whether, again, this is going to further transmit and accentuate COVID is going to be seen, simply because we haven't been able to enforce lockdown. Now, in these circumstances, I think we have to keep all these factors into account. And I would hope, again, that in your second round of survey, some of these consequences would actually be followed up, because I think you need to essentially find out what is going to happen in terms of the various mechanisms for enhancing household incomes, and then also economic activity takes place. The last point, of course, is the government incentive packages. Now, of course, as it has been pointed out, the incentive packages are largely being offered through the banking mechanism as subsidized loans. Now, how far this is going to translate into actual productive activity, and how far it will in fact feed into responding to some of the consumption and saving needs of the beneficiaries who are actually going to be receiving it, is an open question. I mean, what it will do and what it has implications is that it will in fact put the entire risk of the incentive package on an already very vulnerable banking system with high degrees of default and financial indiscipline. And whether in fact the incentive package administered through them in a situation where markets have not revived, production capacities have for logistical reasons not been fully restored, is again going to be a very risky business. So these are all issues we should keep in mind. The government is doing the best it can, but essentially it has to discuss the interface between the economy and the issue of responding to the health problems. And it has to take into then account the interface which will be provided through the quality of governance and administration with which both processes can actually be handled. I look forward to the next phase of your study. Thank you.
Naila Kabir from the London School of Economics. Naila, are you on?
Hear me?
Yes, go ahead.
Okay. So I'm sitting in London and obviously watching what's happening around the world with special attention to Bangladesh. And, you know, Bangladesh has done very well in normal times in looking after the human development of its people. But of course, this crisis is going to be a test for every country. And you know, we talked a little bit about the financial implications of trying to help people. I think when this is all over, we need to also think about what kind of revenue base the government is able to draw on and how seriously it takes mobilizing domestic revenue for precisely times like this and for investing in a far better health service than the one that we have. Because I dread to think what will happen if the infection rates rise to levels that we are at present not seeing. I think another thing that I found a little puzzling sitting here in London is what is the meaning of calling this an extended holiday rather than a lockdown? I mean, that might be a trivial point, but does it communicate the right message? And you know, to what extent does it sort of minimize, in a sense, the implications of what is being asked? One thing I was very struck by in this report is what a very small percentage of people were returning from the urban areas to the rural areas. I think it was 6% or something. And I found that quite puzzling, given that we do have quite a lot of people migrating into urban areas. But at least we were spared the sights that we've seen in India of, you know, large numbers of people having to tramp home. Very drastic, you know, some of the results are drastic, that people only have enough to survive for the next 4 or 5 days. And that is a small percentage, but it's out of a relatively small sample. And if it is at all typical of what's happening in the rest of the country, then, you know, very drastic measures are called for. And I think one of the worries I have about cash transfers, and I can see the logic of it, is to what extent the supplies are there for people to buy. And I think, you know, if we have the infrastructure to distribute food, that would be a very good, a very good way forward. But also other necessities like soap, etc., which would be very important as infection spread. And people have talked about leakages and so on in the chat show, in the chat part of it, and I'm not going to bring that up. I think I would like to return to Zillur's point about the non-poor, the vulnerable non-poor. It really does bring home this arbitrariness of a cutoff poverty line. But one of the things is that it tells us is the vulnerable non-poor may not necessarily be those who were earning less money than the others, but rather those who were the most commodified, in the sense of being completely dependent on their daily or weekly earnings. So in a sense, the occupational breakdown in figure 8 gives me very complementary insights. We actually need to know what the livelihoods of these people are. When you use categories like restaurant worker, you know, what kind of restaurant worker are we talking about? When we talk about artisans. So I really think you should, in your next round, map these different income categories to different livelihood categories. And that will also tell us a little bit about who amongst the non-poor is most likely to be vulnerable. Now, understand this was a very short survey, and so the most you could do on gender is to kind of disaggregate by the gender of the head of household. But nevertheless, I think it gives us some quite interesting results. I think we find that the fall in income is not consistently lower for female-headed households. In fact, it's higher than the urban male-headed households. Where we find a more consistent pattern is the decline in food expenditure and the decline in having ability to have 3 meals a day. And to me, the 3 meals a day is a much more accurate indicator of poverty than money metric measures. So I think the 3 meals a day is telling us female-headed households in both urban and rural areas tend to be far poorer. And I think a point Imran made that rural male heads appear to be quite resilient of all these 4 categories that you have. What makes this crisis, I think, different from many others is that the normal coping strategies are not available to people. We've seen some of these normal coping strategies in the sense of cutting back on food, savings, drawing down on savings, and so on. But usually what people do is to send people out to work, to send women and children and the elderly to go out to work in order to keep the income afloat. But we are not seeing that, and I wonder what that means. And this is where the gender perspective would have been useful if we could have found out how these current coping strategies are impacting on women and children. If you are cutting back on consumption, if food expenditure is being cut back, is the hardship being equally distributed within the household? It's not something you can find out easily through a survey, but I think there are other methodologies by which we need to find out if the old pattern of discrimination in times of hardship is kicking in again. And my final point, I think, is when we look at other countries, one of the very systematic patterns that's coming out is the rise in domestic violence. Again, not something you can capture through a survey. But if people are in times of insecurity and hardship, if consumption is being cut back, I think stress levels begin to tell. And I think, Brac has a presence in many parts of rural areas and urban areas. And I think we need to watch out to make sure that this aspect of people's responses to crisis doesn't take place.
Okay, Naila?
Yeah.
No, go ahead for final point.
I think, I'm done.
Okay. Okay, no, on your very last point, actually, on the table on the priority concerns, mental health was actually stressed. I mean, that's like a signaling the point that you mentioned about the violence issue. Certainly, and I think some qualitative studies are also being planned. I think that would bring out some of these dynamics. Our final designated discussant is Asif Saleh, Executive Director of Brac. I want to bring in Asif now, 5 to 6 minutes again. Asif,
thank you so much. Thank you. Yes, can you hear me? Yeah.
Yes, yes, go ahead.
Thank you. Okay. Oh, sorry. Okay. Yes, thank you again, Zillur and Imran for this rapid research. What I wanted to quickly highlight are not the points that have already been discussed. I think one thing that has been clearly came across from your research and also some of the data that has come out from our work in the last few weeks has been the sort of this data vacuum in the urban space, and also the sort of the lack of years of lack of any support and neglect for the urban poor that has been magnified by this crisis. One thing that was quite startling in this research that came out is that only 6% has actually moved back to their rural areas, which is quite a stark difference from what we assumed. Because when we first started Brac's intervention in terms of emergency cash transfer to the urban slums, we went with a database which we had about a year old. And we found that a majority of the people were not there. So we kind of assumed that they have gone back to their rural home. So it seems like, but we were not sure. There could have, the mobility could have happened in the last 1 year or so. But that's something I found it very interesting. But going back to the sort of the years of neglect, I mean, one thing that has been highlighted is that this is a group that has clearly been not being able to be captured by the targeting mechanism that is currently there. And on top of that, what you have mentioned around the new poor who have joined in this group, together with this combination of the urban poor who have not been supported and the new poor, that has made this whole thing sort of the, when on one hand, government is saying that we are allocating money, but on the other hand, we are seeing people are not getting it. Far more, this crisis, far more sort of worse off than what we have, what we could have managed. So there's clearly a gap between a supply and demand. So essentially, it goes back to targeting, targeting, and targeting. Essentially, going back to the new poor segment, this is correctly pointed out by Zillur Bhai that this is a group that we need to look at much more closely. I agree with Nalapa that, you know, even if we are now thinking around the recovery plan, we need to understand this group a bit more closely and in depth. Because one point, one area I particularly appreciated is that distribution and breaking down of the informal workers as well, and the fact that there's also resilience in different level based on what kind of jobs they are doing, and particularly looking at the restaurant workers who have whose income declined by almost 99%. So this goes back to again planning for the recovery. That, you know, even if we go back in some semblance of normalcy, but in this new normal, the economy is not going to come back up into full speed. I mean, restaurants are going to be probably empty for a while. So some of these jobs are gone for a long time. So how do we support these groups? So there needs to be a deeper understanding of different groups a bit in order to plan for the recovery plan. The next point is, I think, around the coping mechanism. This again validates some of the things that what we are seeing on the ground. The rural resilience is much stronger than urban. And one thing we have noticed in the last few weeks has been that, you know, our borrowers in microfinance, you know, as you know, that for years they have been doing all these savings for the forced savings that is part of the microfinance plan. They actually relied on taking back and withdrawing some of these savings money to keep them going. So this really came handy. From Brac, you know, the last few weeks we have returned or given back their savings to the amount of almost 100 crore taka to a large segment of the rural poor mostly. So the fact that, you know, they are depending on these kinds of savings actually validates what we are seeing on the ground. Next point around, you know, that, you know, the 8th May, just for an interesting, I found that the 8th May being the last day where, you know, the people can bear their sort of live on the savings and stuff for the most resilient group. And the fact that economy started a sort of partial reopening around 10th of May as interesting that I find that, you know, potentially the next level of study perhaps can show that how that this partial opening actually have supported some of this group. Because as you know, this was a big hot debate within the country in terms of whether we opened up too early or whether this was a wise thing to do. The government actually made that decision based on opening up some of the small businesses and stuff. Makes me wonder whether this is partially had to do with this fact that the social transfer was not going to them, and at the same time their savings were getting depleted at the same time. And the last point I want to go back is that in terms of going back to the self-reporting thing that Zillur Bhai mentioned, I think it's becoming very, very important at the more and more in the coming days, just to inform that one small sort of experiment that we are likely to start in June around self-reporting is that we are doing in 7 wards in Dhaka North, we are doing a manual listing. And at the same time, we are going to have a notion of self-reporting. And then we are also including getting some special permission from BTRC to validate the data that is coming from self-reported people to ensure that they are actually falls into this group. So to look at their sort of airtime usage, if they have mobile financial service, what is their potential savings pattern and all that. So using that as another sort of data point to validate whether they are actually deserving for this. So this is something, an experiment we are starting with the work group program in June, and will be also, I think, will be an interesting area to follow for larger learning later on, that whether how effectively this works out. And then we're going to also ground truth this with this physical list that that is getting prepared in combination of the political counselors and at the same time NGO representatives together. So this might be an interesting element that can be scaled up later if this works. Thank you, Zillur.
Thank you, Asif. Thank you. So we have finished our designated discussants. We have some time for comments and observations from others who have joined. So there was this option for raising hands. I haven't, have I see? Yes, Syed Hamid from the Dhaka University has raised his hand. Hamid is the professor of Institute of Health Economics in Dhaka University. Hamid, go ahead, just 1 or 2 minutes, please.
Thank you very much, sir. Thank you very much, sir. My concern is we know that, that the country does not have the fiscal capacity to spend so much money per month as a fiscal support for food and non-food for this number of poor. So I think we need to think in other way. That means how can we reopen the economy, keeping this hotspot based lockdown, not the macro lockdown. You know that the macro lockdown, it's not giving us anything. We cannot control the disease as well, but we are harming our economy a lot. So if we do not take the pragmatic decisions, so as the concern raised, there will be a lot of hunger, starvation. Even if it is continue for several months, then the famine may also start. So there are a lot of social chaos may raise. So I think we need to take the decision both in the context of the society, economic, and the health concern, not only the economic concern or for the other concern. So basically, we are running our time very fast. So we need to come into quick decision how after the 31st May, how the economy will be going on. Are we still continuing this macro lockdown, or we are going to impose this hotspot based effective lockdown? I emphasize on the effective lockdown. The current lockdown is not effective, and the economy is harming, and we cannot control the disease spread. So we need to think in this pragmatic way. Thank you very much, sir.
Thank you, Hamid. So that also raises another type of issue. Anyone else? Hello. Selim Rahan has raised his hand. Selim.
Hello.
Professor, who is this?
Thank you. Nasir.
Nasir, just hold on. Selim Rahan from Professor of Economics, Dhaka University. Go ahead, Selim Rahan.
Thank you, Zillur Bhai. I think that I must congratulate BIGD and PPRC for conducting this study, and which gives us a very kind of first-hand, a very quick assessment, a very rapid assessment, as has been mentioned in the study. I was just a bit curious whether in the second round you would try to expand the sample to include non-slum population as well, in the urban areas especially. As I can understand that the rural sample is more or less nationally representative, but the urban sample has a bias, which has been very, and I think it was mentioned in the power presentation as well by Imran Bhai. So is there any plan to include the non-slum, because the large chunk of the new poor or the vulnerable population are actually in they reside in the non-slum areas too. So that's my question to Zillur Bhai and Imran Bhai. Thank you.
Imran, would you like to quickly clarify?
Yeah, so I want to take both the questions. So with respect, I think, Selim, your point is valid, but we are relying on existing surveys, so that's that's one of the kind of constraints we have, because we need to have a phone contact database. If there are other phone contact database which have non-slum population, we may want to consider that. But we're also very interested in having pretty extensive and comprehensive household survey done, in the sort of as benchmark, because we haven't really exploited that data. But I think that will be really powerful, because all these households, we have got extensive household survey data that one would do in normal times. So that is a very good base, which we haven't fully exploited, and which we are talking to colleagues from LSE to sort of work on how to sort of exploit that more fully. So yes, we definitely should consider, but that this sort of depends on whether there are certain sample frame that we could use for that. And usually non-slum low-income settlement surveys is limited. That's even worse. I mean, Asif was talking about urban vacuum data. I think the biggest vacuum, urban slum, at least we have some. Non-slum poor is the biggest vacuum, and the other big vacuum is the floating population. So on both ends in the urban space we have. So quickly on the other point, Zillur bhai, that was basically raised by Syed Hamid. I think absolutely right. I think we need to look at the kind of smart lockdown strategies, but I think we need to ensure those smart lockdowns are actually smart, and they're based on evidence, and they're based on actual data and mechanisms through which we can manage those localized lockdowns. I think there are a lot of vigilante type of local practices that happen with local lockdowns, which may actually drive stigma and fear even further. Absolutely, we need to think about local lockdowns, but we need to complement that with proper data and proper mechanisms. And at the same time, we need to focus on the health side clearly, because if you're not using the lockdown time period to step up on the health side, we are actually not solving the complex systems problem.
Right. Okay. Good. Thank you. And I think to Salim, the slum population also is a cross section. I mean, in the slum, if you go to Corail, and PPRC has done a survey on the urban poor, in the slum also you have a cross section. Some of them are also not just vulnerable non-poor, some of them may even be non-poor. So slum as a concept, actually we use it as a shorthand. So for the moment, as Imran explained, we will be limited by the contact databases, telephone contact databases, but actually we are actively developing additional contact databases on other important actors, for example, farmers or children or hard to reach areas. Hopefully we'll be gradually expanding our coverage to those two. We are now at it's 3:45. Yes, someone has raised a hand physically.
This is Rafiq from FNB. Federation of
FNB,
NGOs.
okay, and I think, yes, just hold on. And I think AMM Nasiruddin, former health secretary, also I think had his hand up. So after Rafiq Islam, we will have AMM Nasiruddin. 1 to 2 minutes, please. Go ahead.
Yeah, I will be very short. The one thing, as Asif Bhai has mentioned, that the NGOs activities, especially the MFIs, have started their activities in 10th May, partially. So maybe the survey could be done after that day. What is the improvement going on after the NGOs have started their operation? And the government has declared a lot of support packages also. So after operation of these things, how whether the picture is going to be changed or not. Another one, my point is, so the government and the civil societies and the NGOs should be more unitedly face this year. It seems that in some areas, in Barishal district, in the last few days, we have a meeting there. The coordination is not properly done. The local administration is asking NGOs to hand over their all resources to the government machineries. They will deliver, distribute the. Yeah. So it should be it should be very transparent, and it should be very planned wise. It's not. So these are the things should be properly coordinated. Thank you so much.
Thank you. AMM Nasiruddin, former Health Secretary, if you're there. Are you there?
Yeah, I'm here.
Go ahead. Go ahead. Yes, go ahead.
Can you hear me?
Very loud and clear.
Okay. I'll be just very brief. You know, Dr. Usmani has given some excellent suggestions. Having said that, I would like to go with the findings of the study that the support program should include both food and also cash. You know, because why? Professor Rahman Sobhan has also made one point regarding this. But I would like to add that, you see, government has a kind of compulsion to release food grains, because the food grains that are stored in the godowns that get rotten unless they are released to the people in time. So the government cannot take the risk of spoiling the food in the godown. Number two is that government has to make rooms and space for storing the procured paddy. You know, now the government has to give support to the farmers in terms of food procurement. So this procured food has to be stored in godowns, and the godown has to be cleared for storing this food ground. So there is a kind of compulsion on the government, to release food grains. This is number one. Number two is that coming to the compensation package, the incentive package as declared by the government for the small and the medium businessmen, particularly the small businessmen. You see, they will be receiving loans at concessional interest rate, subsidized interest rate. You see, most of the small traders, they have no banking relationship. They are very not used to going to the banks. They have no even bank accounts. They are not used to the rules and regulations of banks. And if the direction is given by the central bank that the issue has to be dealt with in bank-client relationship, based on bank-client relationship, how these small traders are going to access that the facility that is going to be provided by the government from the compensation package or the incentive package. So these are the 2 points I have just said. So thank you very much.
Right. Thank you. Anir Chaudhary has his hand up, and then Rezaul Karim. Anir Chaudhary from the A to I. Anir, go ahead.
Yes. Can you hear me?
Yes.
Thank you very much again for the very excellent study. I was wondering whether the following can be done from A to I with the help of all the 4 telcos and BTRC. We have been doing what is called a syndromic surveillance of health for the last 2 months, which basically means that people have been calling into 333 and have been reporting symptoms. We have about over 7 million calls that have come in for the last 2 months. And this data, very large amount of data, is then analyzed to understand where the disease clusters or the hotspots are forming. So this is one bit of information that can be correlated or maybe combined with the economic survey that you're doing. We're also starting another economic survey with Yale and Berkeley, where we will look at the relative wealth or the poverty levels of people, how it's going up and down, based, again, telecom transactions, calls, the usage of mobile phones, basically, for both sending money, receiving money, and also making calls. So again, that can be combined with the study that you're doing and the repeat survey that you're going to be doing to explore in a much more focused way how lockdown lifting decision can be made at a local level. So we could even go down to the level of a particular locality in Dhaka or maybe in Upazila and say, this is how lockdown lifting can be done. So a combination of health surveillance and economic surveillance can be used to make these more informed decisions for lifting lockdowns and probably even reinforcing lockdowns based on how things are moving. So because economic activity will almost inevitably lead to more infections, but again, we have to do the right balance between lives and livelihoods. So if that can be done, then we'd like to work with BIGD and PPRC to see if that can be done. Thank you.
Wonderful. So you would be in a position to share some of this hotspot location data.
Yes.
That would be great. So we'll have a follow-up meeting with you later on. Actually, that would be great. Wonderful. Rizaul Karim from the World Food Program.
Yes, thank you for such a good report, and we are listening, and it was so nice to hear all of these intelligent people and their advice. But I have one thing to just suggest that, okay, if you look at the number that you are talking and the amount that is required for rehabilitation, at times, if you look at Bangladesh government now, their usual investment in social protection is in the order of 3%. And then again, you are talking about that, okay, let's add 4%. These numbers are a bit too much, and if you look at the fiscal space, is very challenging. But at the same time, the suggestion that comes in is that let's open up economy in a disciplined way so that the cost can go down. But what I would suggest rather is that if you look at the coping strategies closely and put together some sort of an understanding that, yes, it is the cost that is needed. But if we do not do that, what would be the cost of not doing those investments? So putting the other angle into it, is it possible somehow to say that, okay, this is so much money has to be invested to save to at this stage, but at the same time, can we bring some sort of analysis that said if we do not do that, what would be the cost of not making that investment? So that's an analytical piece would also help to prioritize that, yes, we know this is too much, but again, if we do not do this, how big it would be, the cost of not doing that. That if it is possible for the next round, I would say that to build such considerations. Thank you so much.
Thank you. Thank you, Rizaul, for that. I don't see any further raised hands. We have had an excellent discussion. It's 3:53 now. Anyone? I'll just scroll down to see if there is any last. Okay, no more hands I see. So I guess we have had an excellent contribution both from our designated discussants as well as, so to say, from the floor. And I see that a number of people from around the world have also joined in. David Hume from Manchester. I also see Joe Food from Bath actually has joined in. So a number of people have joined in, and I really, myself and Imran, I'm sure also are extremely happy that the report has been useful. We really took it on as a very immediate challenge of some sort. And I'm very happy to see that it has really helped to spark some debate. Before I give some concluding comments, I want to ask Imran if you want to have any last words.
Not really. Thank you very much. I just also want to, echo what you said, Zillur Bhai. I think the response has been really good. The questions that we have received, I mean, we could not really go through all of them. I've been trying to respond to some, but I think some are excellent ideas that we will take on, as we sort of move forward. The hotspot location is going to be really important because we really need to, kind of layer that into our analysis in terms of differential effect of the infection. I think that's going to be really important. Focusing on the impact of lockdown is going to be also, I think, another strand that we anyway have been thinking about. So it's going to be, we'll obviously put in there. But I think, a few points have been raised, which I think is really not going to be the, kind of the real purpose of what we are doing. What we are trying to do is really do a trend analysis and some of this modeling work that I think some have been talking about are things that we can feed into. And I think that is the other thing that we already have been thinking about. And I think we need to really explore how we actually become part of a much larger ecosystem of action and analysis that's basically happening and how we contribute into that. Because I think that's how I think we can also create impact. And that's something we need to think about and talk about very actively. And thank you very much.
Okay, Imran, thank you so much. And I think I'll just take off from that last point from Imran is that I think this whole exercise has also reinforced for us the social responsibility of the research community actually. And they also are part of the overall ecosystem in finding solutions and in finding, in a way, I think what Imran said at the end, that everyone have to play a role here. It's not just one report or other reports alone, but how all these inputs can together do justice to our intention to have society move forward well on both the pandemic and on the economic crisis. Just to summarize in terms of the larger takeaways, and I think we have got some excellent suggestions about slightly recalibrating our plan for our second survey. So we'll take those on board. But just to summarize, that there are some points which are about the immediate COVID-19 response. I think, for example, I think we, in a way, if we have managed to push the idea that in terms of the scale of the social support which is necessary, the figures that we have given about nearly 70 million poor and non-poor are nearly half the population, actually, as Usmani mentioned. So it's not necessary, Rizal Karim mentioned fiscal space. We understand that very well, but I think it is important to also put on the record the scale of the impact. And that's, I think, one of the things that we tried to do, and in particular, the entitlement requirement. So that's an issue related to the current context itself. I think the food cash, points have come forth on both sides, and I don't think we should be taking a ideological position here. On the practical grounds, what makes sense, that's what we have to really do. Critically, I think the impacted population, which is nearly half the size of the population, they will have to be supported both through social protection measures and also through intelligent revival of the economy. Both of those routes have to be pursued. We understand that very well. But even among, we have given this slightly maybe larger figure of the poor and non-poor, but there are a huge group who actually cannot do without social support. And I think that needs to be underscored very much. One point has puzzled everyone, including us. Why was there so small movement back to the villages, in particular these urban poor? And it was a puzzle. In fact, I actually insisted on having that question at the beginning, because I thought, my sense was that a huge group had moved. But I think that's giving us a message that the choice for the urban poor may be limited in terms of this locational change as a coping strategy, migration as a coping strategy, particularly in context when there is large-scale economic, uncertainty. But I think in terms of the longer-term analytical issues that we need to take on board, one, of course, is the new poor. That is true. And the whole idea of urban social protection, I think, now has to be brought on independently of how COVID-19 plays out. Urban social protection will have to become an important policy agenda in the coming days. I think that is very, very important. And second one, I think Nala also mentioned, and I feel also very much that the urban poor issue or the vulnerable non-poor issue is not just a social protection issue. We also have to look at their economic, the livelihood realities, and how much policy support those realities are getting. One issue which has come out very strongly in this whole process, I've written about it in a different op-ed, is that we have talked about 11,000 crore taka around as a support needed. Now, this we are articulating through a research, but groups within society, particularly formal sector groups, who I coined this term, that voice muscle. The poor lack, they are not just poor, they are also poor in terms of voices. They lack voice muscle. And it's very important for research like this to really push through the idea of their needs in articulate it, bring it to the public discourse. So I think this issue of the poor and their needs, they may not be able to articulate it so strongly through their voices, as, for example, formal sectors like RMG and others have been so effectively able to do. So I think here, our research like this, I think, is very important to do that. And we have to team up with others. Brac has mentioned, Anil Chaudhary has mentioned A2I, and development partners like World Food Program and others, we will be in touch with them. And lastly, I want to also add on that point that I mentioned about the last mile delivery challenge. Others can mention this in terms of governance issues, but I think that also isn't something that we have to bear in mind, that this listing which is going on, the preparation of list, is not just a technical issue, it's a overall governance issue. And how we make sure that in preparing this list, we are not just doing the bureaucratic task, but we are also ensuring those accountability and transparency tasks is, I think, also critically important. So I would like to close this session here and thank everyone for joining in. If you our report is of course shareable, and I think if you leave your email with us, both PPRC. Hello.
It's on the web. It will be on the web.
We'll also be.
We have the emails of all the participants. We'll send the report.
Great. Excellent. So we will share it both through email as well as it will be on the web. And we really want this to be open source discussion material. So I think on behalf of PPRC and BIGD and the excellent teamwork that both organizations have done, I want to thank everyone for participating. I would like to close this session now. Thank you, everyone.